foreign nationals are still being blocked from accessing public healthcare facilities in parts of the province. Activist groups insist that scores of undocumented immigrants have overburdened the system at the expense of citizens. But officials have criticized this, expressing concern that these actions could deepen social divides and compromise efforts to control the spread of diseases. Veronica Makhoali joins us live now from a clinic in Rosettenville, Johannesburg. Veronica, what's the situation like outside that particular hospital? And is there a sense then of what might be some sort of understanding as to where we sit when it comes to letting foreign nationals, of course, be using our public healthcare system? And a big question mark around legislation to that too.
Well, certainly, Arabil. In fact, the Constitution is very clear when it comes to that everyone has a right to access healthcare services, despite your nationality or any sort of legal standing. Healthcare services are made to be available for each and every person within the borders of South Africa. But there is a lot of pushback that is coming from ordinary citizens as well as groups speaking about that issue of saying there is undue pressure on some of our clinics and healthcare services, with some people really taking these efforts to the clinics themselves. We watched this morning as people lined up. In fact, here at Rosettenville this morning, it was meant to be for appointments for expecting mothers, a queue of pregnant mothers standing. And we watched as community members had to, present their IDs forward. Those without IDs, South African IDs, valid South African IDs, were denied access inside of this clinic specifically here. And listening, of course, to the Health MEC of Gauteng speaking about access to health, it really also does show that there is quite a big contradiction in that regard. Knowing officials are aware of what is taking place and yet still pushing for those vaccination drive, what then happens to those that are needing the basic access to care? We've seen people here who spoke to us this morning telling us that they have not been able to get their high blood pills for about 2 months now. Others who, like I mentioned, expecting mothers, saying that they are, of course, looking for a treatment. But I'm joined by Nozikoza, who is amongst the ordinary South Africans that have been on this relentless campaign, essentially to look out, as you guys have explained it, for the resources of South Africa. Talk to us essentially about, so far now, it's been at least almost 2 months of this campaign, just the reaction that you've been getting from some of the residents on the ground.
No, like foreign nationals, they're fighting us. They told us straight that they will fight back because they also deserve to have access to these healthcare facilities. But we are still standing here. It's almost 2 months now. We're not going anywhere. If it needs them to fight, then they should bring it on, because we're protecting our resources. It's too much now. We can't carry 54 countries. We cannot do that. Yes.
Are you not concerned about the fact that those that are not getting health treatment, those that have not been able to get the pills that they need for some of the chronic illnesses that they have, is going to in fact have a detrimental effect for not just the province of Gauteng, but the country at large, with the fact that these diseases, these issues are not being contained, are not being treated?
It's not really like that. The private healthcare are open for them. They're always coming here insulting us, telling us that South Africans are unemployed, we are poor, we are depending on 370 grant. So we told them it's fine. Public healthcare facilities are wide open for them. It's simple as that. So they will do that deliberately to spread those diseases. This one is only reserved for poor South Africans. We still stand on that. They have countries, these people. We only rely on South Africa. We can't go anywhere. This is only our country. We can't invade other countries like they do. So we are here. We're going to be here until we win.
We spoke to some of the expecting mothers in the queue this morning, who some of them pleaded to me and said, what does my innocent child have to do with the fact that I don't have an ID? There was a woman here who had a passport, an identification document, if you will, and saying that her child is innocent in this matter. We were also listening just recently, my colleague speaking to the MEC of Health, speaking about the fact that this campaign needs to have a heart for some of the women and children that come to these facilities. What do you say about that?
You can't risk the kid's life. These people, they jump border. Immediately they found out that they're pregnant. They just decide to jump border to come here and give birth. What about South Africans? The beds are short. South Africans are sleeping on the floor because of We must have Ubuntu. No, it's too much. They must go to private hospitals, private clinic, or go back and give birth there. Simple as that.
Well, thank you for your time, Nozi, because they're speaking about their efforts essentially and what they call their efforts to protecting the resources of the country. But Arabile, if you would allow me just to speak to a gentleman here earlier who was denied access to get his chronic medication. Thank you so much. You live on Newzroom Afrika. Just show me just the documentation you have and walk me through what happened this morning when you approached the clinic gates.
I come because I am legally in South Africa and I got a permanent residence and ID. Because it's written from Zaire and non-citizen, they refuse for me to access the medication.
And how long have you been without your medication? And you know, how are you starting to feel in terms of your health?
You say?
How long have you been without your medication, and how has it been in terms of your health?
No, yeah, I'm okay. My appointment was today. I'm supposed to collect today for next 3 months, and they say it's only for South African.
Well, thank you so much for your time. Arabile, this gentleman here in particular is holding an ID, and if you could just see just from the gate there, an individual coming in, having to present and show their ID. In fact, when we were here, there were some people who were even South Africans, and they were saying that they are unaware of this process. They are unaware, they were not told, and that they didn't receive any official confirmation or information from the health department or the clinic themselves. And you'd understand that South Africans would not have gotten that communication, because this is something that ordinary citizens and groups have taken upon themselves to create this kind of administration process at the gates of clinics. We've also hearing that at various clinics in Gauteng, the system is very different. You'd arrive, if you don't have an ID, you are told that you cannot get any kind of help at all. Sometimes there are other clinics where they will allow South Africans with valid ID documents to get services first, while others are taken to the back of the queue and are told to have to wait until it is their turn. And so this kind of contradiction shows that perhaps there is a bigger concern in what could happen, in the impact if people are not allowed to get access to healthcare services, but also the contradictions between the health department and what individuals essentially have set on a course for themselves, and not having any kind of leadership at this point to say and to prevent what is taking place here.
Veronica, a really detailed crossing there. Thank you so much for bringing us that update indeed. And just that healthcare facility on its own kind of showcases then the plight that is currently happening across the country as well when it comes to foreign nationals being denied healthcare.